Hello students, today topic is digestion and absorption. We are going to discuss this topic in brief completely. This digestion and absorption we are going to discuss in brief. See, we are dividing the digestive system. We are dividing the digestive system into two parts. See, one is the alimentary canal. One is the alimentary canal, and next associated or digestive associated glands. We are dividing the digestive system in the human beings into two parts, alimentary canal and associated glands. So let us see the alimentary canal. So the digestive tract, or it is also known as the alimentary canal or gastrointestinal tract. So it is present, the gastrointestinal tract, which is present from mouth to anus, that is known as see alimentary canal. The anterior opening of the alimentary canal is mouth. The posterior opening of the alimentary canal is the anus. See, the first part of the alimentary canal is see the mouth. See this mouth, actually it is a space between the two lips is the mouth, and this mouth leads into the oral cavity or the buccal cavity. Oral cavity or the buccal cavity. Actually see this mouth, it is a small space now. In the oral cavity there are particularly on the upper surface of the oral cavity, means on the roof of the oral cavity there is a soft palate and a hard palate are present. Hard palate and soft palate. This hard palate is present on the anterior side and soft palate is present on the posterior side. On the posterior side. See here, this hard palate, it has formed by the maxilla and the palatine bone. With the help of maxilla and the palatine bone, this hard palate has formed, and just in the posterior side of this, on the roof of the oral cavity, the soft palate, arch-shaped muscular soft palate is present. And see, in the oral cavity, along with this here, and from the soft palate, a conical process is hanging, that is known as uvula. That is known as uvula. See, both the soft palate and uvula are helping to prevent the entry of the food materials into the nasal chamber. Okay, and next see this in the oral cavity. Along with this here, the oral cavity on the lateral side of the oral cavity are covered by the cheeks. And see this in the oral cavity, the teeth are present and the tongue is present. Teeth and tongue are present in the oral cavity. See, in the human beings, thecodont teeth are present. Thecodont teeth are present in the human beings. Here the teeth are fitted in the sockets of the jawbone. Thecodont teeth and diphyodont teeth. Diphyodont teeth, only two sets of teeth are formed. One is milk teeth. One is milk teeth, and next see permanent teeth. Permanent teeth. Two sets of teeth are formed during their lifetime, that is diphyodont teeth, thecodont teeth, and different types of, four types of teeth are there, the incisors, canines, premolars and molars. That is, we can say heterodont teeth. Heterodont, diphyodont, thecodont teeth are present. And see, the teeth majorly it is formed by the dentin. Majorly it is formed by the dentin. Actually, dentin is the harder, it is harder than the bone. It is harder than the bone. And see, this dentin is secreted by the odontoblast cells. Odontoblast cells. Actually, see, these odontoblast cells are mesodermal cells. Mesodermal cells. Mesodermal cells. And remember this dentin on the, actually we are dividing the structure of a teeth actually on the crown, neck and root. The crown, the dentin which is present in the crown, that is covered by a hardest substance, that is see enamel. Enamel is the hardest substance which is covering the crown of the dentin. See, it is secreted by amyloblast cells. Amyloblast cells. This amyloblast cells actually they derived from see ectoderm. These are the ectodermal cells. Ectodermal cells. See, like this here, ectodermal cells are producing. Ectodermal cells are producing these amyloblast cells, and see, these amyloblast cells are producing this enamel like this, and the root of the dentin is covered by a cementum, and the gums are covered by periodontal membrane. And see, in the human beings there is a milk teeth are there 2102 by 2102. It is the dental formula of the milk teeth, and permanent teeth 2123 by 2123 here. Incisors, canines, premolars and molars, total 32 are the permanent teeth and 20 are the milk teeth. See, like this, milk teeth and permanent teeth are present here in this. And like this, the teeth are present, and see the tongue. If you see the tongue, so it is connected to the oral cavity here with the help of frenulum. With the help of frenulum, it is connecting to the oral cavity, and on the surface of the tongue, many papillae are present. Okay, so those are three types of papillae are present in them. See, fungiform papillae, next filiform papillae, next circumvallate papillae, fungiform papillae, filiform papillae, and next circumvallate papillae. These are the three types of papillae are present. See, fungiform papillae, actually they are in the shape of mushroom shape, and they are present at the tip of tongue. And filiform papillae, these are present in the shape of thread-like papillae, and these are present at the in all surfaces of the tongue. These filiform papillae are present, and circumvallate papillae, they are present at the base of the tongue. Particularly, they are in a row. That row is in the inverted V shape, and the circumvallate papillae are large-sized papillae. Got it? Like this, these three papillae. In these papillae only, the taste buds are present. The tongue is acting as a universal toothbrush. The tongue is acting as universal toothbrush because the tongue which helps to mix the food material with the saliva. Like this, the oral cavity is present. And next, this oral cavity which opens into the oral cavity, next which opens into the pharynx. The oral cavity which opens into the pharynx. See, in the pharynx there are three parts are present in the pharynx. Three parts are present. See, one is the nasopharynx, next oropharynx, and next laryngopharynx. Nasopharynx, oro, laryngo. Into the nasopharynx, one pair of eustachian tube are opening, and at the same time here what we can say, this oral into the eustachian tube is opening, internal nares or internal nostrils are opening, and tonsils are opening into the nasopharynx. And into the oropharynx, oral cavity is opening. Oral cavity opens into oropharynx. Laryngopharynx, which opens into the esophagus and which opens into the larynx. Behind the laryngopharynx, behind which opens into the esophagus, in front which opens into the larynx. Like this, the pharynx is present. It is a common passage for air and the food. So that's why it is a junction of both air and what we can say nasal, respiratory tract and digestive tract. Like this, the pharynx is present. This pharynx which opens into the esophagus. Esophagus is a small, it is a long narrow tube which travels, actually here it crosses thorax. here it is traveling through the thorax, and next it enters into the abdomen, and when it enters into the abdomen, see, which pierces the diaphragm, like this esophagus is there, and on the esophagus there are two sphincters are there. One is a upper esophageal sphincter and lower esophageal sphincter. Remember, upper esophageal sphincter is made up of by skeletal muscle, and lower it is made up of by smooth muscle. Here lower esophageal sphincter, it is also known as cardiac sphincter, which opens into this lower esophageal sphincter is present between the esophagus when it opens into the stomach. Between that, this cardiac sphincter is present. Like this esophagus. Next, see stomach. Actually, stomach, it is in the shape of J-shaped part. It is present on the left side of the abdomen. Okay, left side of the abdomen, the stomach is present, and in the stomach there are four parts are present. See cardiac region, and next see fundic region, and next body, and next pyloric region. These are present in the stomach. Cardiac, fundic, body, and pyloric regions are present in the stomach. The food will be stored. The food will be preserved, and the food is around 4 to 5 hours. The food is stored in the stomach. That is like the stomach is present. And next see the small intestine. Actually here in the small intestine there are, see here, duodenum, next jejunum, and next ileum. Duodenum, jejunum, and ileum are present. Duodenum, it is around 0.3 meters length, and its size, it looks like C shape. It is in the shape of C. Okay, and jejunum, into the duodenum only. Here both pancreas and liver are opens into the duodenum, and jejunum, actually in this only here it is around 1 meter length, and in this only here the chemical digestion of food and large absorption of food is taking place in the jejunum. High amount of chemical digestion and high amount of food reabsorption is taking place in the jejunum only. And ileum, it is a 2 meters length. It is the longest part of small intestine. The ileum is the longest part of small intestine. And remember, this ileum, it is a long coiled tube. It is a long coiled tube. See here, 2 meters length it has. See, like the small intestine is present, and next see the large intestine. The small intestine opens into the large intestine. The small intestine opens into the large intestine. Through here there is a ileum. That ileum is there. That ileum opens into the cecum. Actually, in the large intestine there are 3 parts are present. One is a cecum, and next colon, and next rectum. See here, this ileum opens into the cecum through, at that place there is a ileocecal valve. Ileocecal valve is present. And from the cecum a vermiform appendix is also arising from the cecum, and in the cecum there is a symbiotic bacteria are present in the cecum. And colon, actually see, it is here in this there are first ascending colon, and transverse colon, and next see descending colon, and sigmoid colon are present. These all are here depending how they are arranged, like this ascending colon, transverse, descending, sigmoid colon. It is in the shape of S. Here, like this, the colon is present, and see the rectum. Here, in the rectum only here, the undigested food will be stored in the rectum. Okay, see this rectum which opens, actually the narrow part of the rectum is known as anal canal. So this anal canal which opens into outside through the anus. In the place of anus, see there are 2 types of sphincters are present. One is internal sphincter, internal sphincter and external sphincter. External sphincter. Internal sphincter, it is made up by smooth muscle. It is made up by smooth muscle. And external sphincter, it is made up by skeletal muscle. Skeletal muscle. That's why here the defecation is the voluntary process. Because of this, due to the presence of this skeletal muscle, the defecation is the voluntary process. Like this, here the alimentary canal is present here like this. And if you see the associated glands, how the associated glands are present? What are the associated glands? See, salivary glands are present in the alimentary, along with the alimentary canal. Salivary glands. In the human beings, only 3 pairs of salivary glands are present. Actually, in the mammals, remaining mammals, 4 pairs of salivary glands, but in the human beings, only 3 pairs. Infraorbital gland is absent in the human beings, but remaining 3 pairs, parotid gland, inframaxillary or inframandibular or submaxillar or submandibular gland, and next sublingual. Parotid, submaxillary, sublingual. These 3 pairs of salivary glands only present. And next, you see here, after salivary gland, there is gastric glands. The gastric glands which are present in the stomach. The gastric glands are present in the stomach. Gastric glands. See, particularly in the stomach, there are, in the cardiac region. Cardiac glands are present in the cardiac region, and pyloric glands are present, and in the fundic region, fundic glands are present. From the what we can say cardiac region and from the pyloric region, mucus is secreted, and remaining from the fundic region. The fundic region is composed by peptic chief cells, mucous neck cells, oxyntic cells. From the peptic chief cells, here the pepsinogen, prorenin are secreted. From the mucous neck cells, mucus is secreted. Got it? Mucus is secreted. And next here oxyntic cells, or we can say parietal cells. From these HCl, hydrochloric acid secretes. These all are fusing together to form the gastric juice. Like that, from the gastric glands, gastric juice is secreted. And from see here intestinal glands. Intestinal glands. See, the intestinal glands, actually here they are present as the Brunner's glands and the crypts of Libercum. See here, these Brunner's glands are present in the submucosa of duodenum, and these crypts of Libercum are present in the mucosa of the small intestine. See here, from the Brunner's glands, the alkaline mucus is secreted. From the crypts of Libercum only this intestinal juice is secreted. Intestinal juice, or it is also known as the intestinal juice is also known as saccus antivicus. See, in the intestinal juice or in the saccus antivicus, different types of enzymes are present. See, disaccharidases such as maltase, sucrase, lactase. These are the disaccharidases. These are present. And dipeptidases, tripeptidases, aminopeptidases are present in the crypts of liver, in the intestinal juice. And also along with this, see here, nucleotidases, nucleosidases. These are also present. And along with this, here in the intestinal juice, there is one enzyme activator is present. That is here what we can say enterokinase. Enterokinase is the enzyme activator, so which helps for the conversion of trypsinogen into trypsin. Trypsinogen, proenzyme, trypsin, active enzyme. Trypsinogen is converted into trypsin by this enterokinase enzyme. Like this here, these are the different types of enzymes are present, and in this intestinal lipase is also present. Got it? And along with this, here see the liver. Liver is present. Here two-lobed liver is present. Liver is the first largest gland in the human beings is the liver. two-lobed gland. Two lobes are present. Right lobe is large sized and left lobe is small sized. Actually, it is present on the right side of just beneath the diaphragm. So this liver is present, two-lobed. Right lobe is large and left lobe is small sized. Those two are separated by the mesentery. Remember, every lobe, its structural and functional units are we can say here hepatic lobules. Hepatic lobules are the structural and functional unit of the liver. Every hepatic lobule, it is in the hexagonal shape. Every hepatic lobule is made up of by many hepatocytes. These hepatocytes, they are arranged as the hepatic cords. They are arranged as hepatic cords. So these hepatocytes, they open into canaliculi. Actually, from the hepatocytes only bile is secreted. Bile juice is secreted from the hepatocytes. Those hepatocytes, they open into canaliculi, and those canaliculi, they open into ductules and bile ductules. Bile ductules, they fuse together to form bile ducts, and so these bile ducts fuse to form right hepatic duct and left hepatic duct. Those two ducts are fusing together to form common hepatic duct. This common hepatic duct, which is coming out from the liver. So there is one cyst is present, that is we can say gallbladder. From the gallbladder, cystic duct is coming out, and with the cystic duct, this common hepatic duct are fused together to form the common bile duct. And this common bile duct is fused with the pancreatic duct. From the pancreas, actually from the pancreas another duct is arising, that is pancreatic duct. Both pancreatic duct and this common bile duct. So these two are fusing together. These two are fusing together to form hepatopancreatic ampulla. This hepatopancreatic ampulla which opens into the duodenum. When this hepatopancreatic duct opens into the duodenum, there is one sphincter is present, that is a sphincter of Oddi. Sphincter of Oddi. See, from the liver, particularly from the hepatocytes of hepatic lobules, bile juice is secreted. Now in that bile juice, no enzymes, only bile salts and bile pigments are present. Bile salts are sodium and potassium, glycocholates and taurocholates, and bile pigments are bilirubin is the main bile pigment. Okay, like this, bile salts are helping in the emulsification of fats. Like this, here these bile juice is present, no enzymes are present in the bile juice. And see, in the pancreas, the pancreas is the second largest gland. Pancreas is the second largest gland, and see, it is present in the loop of duodenum. In the loop of the duodenum, the small sized pancreas is present. It is the second largest gland. See, in the pancreas, actually it is actually acting as the mixed gland. It is acting as the mixed gland. That means from this both enzymes are secreted and hormones are secreted. Both exocrine part and endocrine part, these two are present in this. Exocrine part is the here pancreatic acini are present. Pancreatic acini are acting as this exocrine part, and islets of Langerhans are acting as this endocrine part. From the pancreatic acini only. See, from the pancreatic acini only. From the pancreatic acini only, this pancreatic juice is secreted. Pancreatic juice is secreted. Remember, in the pancreatic juice, trypsinogen, chymotrypsinogen, procarboxypeptidase, okay, and pancreatic lipase, these all are present in this. And pancreatic amylase, these all are present in this. Got it? So like this, the pancreas is present. Of course, endocrine part is also there. So that is islets of Langerhans, alpha cells and beta cells are present. Like this, alimentary canal and associated glands are present. And let us see how the food digestion is taking place. How the digestion of food is taking place, we have to see. The food digestion is taking place in the mouth. See, first in the mouth. In the mouth, there are salivary gland is there, na? The salivary gland. The salivary gland secretes saliva, na? In the saliva, there is a salivary amylase enzyme is present, na? That salivary amylase digest. That salivary amylase, or we can say tyrine enzyme, that digest the starch. That digest the starch into that digest the starch into, see, maltose. The 30% of the starch is digested in the mouth, so particularly in the oral cavity. See what is digesting here? See, salivary amylase. The salivary amylase is digesting the starch into maltose. And next, see, when it enters into here from oral cavity and the deglutition is taking place, and the bolus which has formed in the oral cavity, that bolus is entered into the esophagus by the peristalsis movements which enters into the stomach. In the stomach, only protein digestion has taken place with the help of see, pepsinogen. See, the pepsinogen is converting into pepsin. See, pepsinogen actually it is the inactive form. This pepsinogen is converting into pepsin with the help of HCl hydrochloric acid. This remaining pepsinogen, again it is converting this pepsinogen into here again into the pepsin here like this. It is autocatalysis. And see here, along with this pepsin, prorenin is also there. This pepsin, what it is doing, it acts on the proteins and it forms those proteins into proteases and peptones. And next you see here, along with this prorenin is converting into renin with the help of this HCl. And then renin, what it is doing, which acts on milk protein. What is the milk protein? Casein. The renin which acts on milk protein casein, then the casein is converting into paracasein. Then paracasein fusing with the calcium ions and forms a calcium paracaseinate. That calcium paracaseinate which has digested with the help of pepsin enzyme into peptones. Finally, in the stomach, only protein digestion, partial protein digestion has taken place. And in the small intestine, if you see in the small intestine, all proteins, carbohydrates, lipids digestion has taken place. See how the protein carbohydrate digestion has taken place in the small intestine. See, first there are in the pancreatic juice, there is pancreatic amylase is present. That pancreatic amylase, what it is doing, which converts the starch into maltose. Then after that, in the intestinal juice, there are some enzymes are present. See, maltase digesting the maltose into glucose plus glucose. And next, see, after the maltase, next here what we can say, sucrase or invertase. Sucrase or invertase is digesting the sucrose into glucose plus fructose. And next, see, along with this lactase enzyme. Lactase enzyme digesting the disaccharide lactose into glucose plus galactose. Like this, finally here all monosaccharides are formed. Finally, the carbohydrate digestion has completed in the small intestine. And see, proteins. So proteins already here, some proteases and peptones already formed in the stomach. In the stomach, proteases and peptones already formed. Those proteases, peptones and proteins, on these here trypsin and chymotrypsin and carboxypeptidase, they are acting on them and dipeptides are formed. These dipeptides are digested by the dipeptidases of intestinal juice. Finally, we will get amino acids. By the formation of amino acids, the proteins digestion has completed. And lipids, see here in the intestinal pancreatic lipase digesting the lipids into fatty acids, particularly first monoglycerides and diglycerides. These monoglycerides and diglycerides are digested by the intestinal lipase and finally form fatty acids and glycerol. Like this, lipids digestion has completed with the help of intestinal lipase and pancreatic lipase. Like this, proteins, carbohydrates and lipids digestion has completed in the alimentary canal. Okay, and like this, the digestion is taking place, and the food which has not digested, that is forming as a fecus or feces, or that feces will be formed in the large intestine, and that is formed as a in the rectum, and by the defecation process it goes into outside. And absorption of food material.
So the digested food, the simple food molecules are absorbed in the different manners: passive transport, active transport, osmosis, facilitated transport. By all these methods, the food is absorption. And the food absorption, particularly in the mouth only drugs are absorbed which are present, the blood capillaries which are present beneath the tongue, the drugs are absorbed. And see, in the stomach, water, salts, drugs, and moderate amount of simple glucose, simple carbohydrates are absorbed in the stomach. And in the small intestine, the absorption of absorption of water and electrolytes. Water is absorbed by the osmosis, and electrolytes, sodium is absorbed by active transport. Okay, and chlorides are absorbed by the simple diffusion method. And next to see the absorption of carbohydrates. Glucose is absorbed by the sodium, active transport, and some amount of glucose is absorbed by the simple diffusion method. And see, fructose is absorbed by the facilitated diffusion, and some glucose ions they absorbed maybe with the help of carrier proteins. Like this, absorption of carbohydrates is taking place. And see, at the same time, absorption of lipids. Generally, the lipids are the simple forms of the lipids are fatty acids and glycerol. These are insoluble in water and blood. That's why here these fatty acids and glycerol, first they convert into micelles. Those micelles, they enter into the epithelial cell which is present in the wall of small intestine. When they enter into the epithelial cell in the wall of small intestine, see, after reaching into their cytoplasm, these fatty acids and glycerol are synthesized into the triglycerides. And already in the cytoplasm of that epithelial cell, maybe the phospholipids, cholesterol, okay, and fat soluble vitamins are present in that cytoplasm of that epithelial cell. Along with that, these are forming as a mass. Around this mass, here a protein layer has developed. So that stage is known as chylomicron. That chylomicron, now it is coming out from that epithelial cell by the exocytosis process, and now which reaches to the interstitial fluid, and from there, from the interstitial fluid, here it reaches to the lacteal. Here there is a large lymphatic vessel, and from the lacteal, which enters into the which enters into the different types of lymph vessels, and finally reach to the thoracic duct. When it reaches to the thoracic duct, from there finally it enters into the bloodstream through the left subclavian vein. Into the left subclavian vein, so these the chylomicrons are entered. See, after enters into the blood capillaries, the wall of blood capillary is made up of by endothelium. In the endothelium, one enzyme is present. In the wall of endothelium, one enzyme is present. That is a lipoprotein lipase. That in the lipoprotein lipase here, which helps for the digesting of these triglycerides which are present inside these chylomicrons into fatty acids and glycerol. Again, these fatty acids and glycerol are formed. These fatty acids and glycerol, now they reach to the adipocytes or hepatocytes. In the adipocytes or in the hepatocytes, they will be accumulated. Again, they will be synthesized as the triglycerides. They stored in the adipocytes or in the hepatocytes in the form of triglycerides. Like this, absorption of lipids is taking place. Remember, the lipids are insoluble in blood and water. That's why they are taking indirect route here like this. That is the absorption of lipids. And see here, like this, if the undigested food is forming as a feces, so that is developing in the large intestine, that is forming in the large intestine, and in the large intestine only the water absorption is taking place, some drugs absorption is taking place, and some vitamins, B complex vitamin and vitamin K absorption is taking place in the large intestine. Got it? And see here like this, the defecation process, undigested food is going into outside through the anus, and the defecation is the voluntary reaction actually. So here, and because of at the anus, there is external anal sphincter is made up of by skeletal muscle. Okay, and at the same time, in this here defecation process is the mass of peristalsis reaction. A mass of peristalsis reactions are taking place at the time of defecation process. Like this, the defecation and assimilation. Here, on the digested simple food molecules, finally they enter into the blood, and from there, from the blood or lymph, finally they reach to the cells, and in the cells, here those are utilized. That process is known as assimilation. Okay, and in the wall of small intestine, many finger-like projections are present. Those are villi. In the villi, artery, vein, okay, and lacteal are present. See, these villi are helping for the increasing the surface area absorption. The function of villi is increasing the surface area absorption is the function of villi. Like this, absorption, here assimilation and defecation is taking place here like this. And calorific value. If you take 1 gram of carbohydrates, from the 1 gram of carbohydrate, we will get 4 kilocalories energy. From the 1 gram of protein, we will get same 4 kilocalories energy. From the 1 gram of lipids, 9 kilocalories energy we will get. Okay, and but among these three, first we will get the energy from the carbohydrates only. Immediate energy giving sources are the carbohydrates because they are immediately oxidized when you compare with the proteins and lipids. Lastly, the lipids are oxidized. They are taking more time for, lipids are taking more time for the oxidation. First, which are oxidizing among these three? Nothing but carbohydrates. Got it? Like this, that is the calorific value of the different food materials. And along with this, here what we can say, the disorders of digestive system. In the digestive system, first you see jaundice. Actually, the digestive tract, while we are eating the food, maybe many bacteria or viruses are getting infected. So oftenly it is getting infected. When we getting the infection of bacteria or viruses, there is a inflammation is taking place in the wall of alimentary canal. Okay, and the wall of alimentary canal here or intestine, it is repeatedly or so some parasites are also getting infecting. There is a chance to infecting to the intestine particular. Some intestinal parasites are there. See, such as tapeworms, what we can say, ringworms, roundworms, seatworms, pinworms. These all are the hookworms. These all are the intestinal parasites. These intestinal parasites are here infecting to the intestine. Got it? And also here other disorders are also seen in the digestive system. What are those disorders? See, jaundice. Generally, or it is also known as icterus. So this jaundice or icterus, how generally here we are getting, generally if the bile pigments are accumulated more in the blood, so then at that time we will get this jaundice. If more bile pigments are accumulated in the blood, at that time we will get this jaundice. So if bile pigments are more accumulated, that leads to changing the color of the skin and changing the sclerotic white area of the eye into yellow color. The skin color changing into yellow color, and also the sclerotic layer of the eye also change into yellow color, and sometimes we can excrete the urine. That urine is also in the color of yellow. Got it? Like this, these are the symptoms, and the person will become very lean, and he is not getting the hungry also properly. So why the number of, the percentage of bile pigments are increased because of here the destruction of more number of RBCs are taking place. If the RBCs number, if the more number of RBCs are getting destructed, automatically this bile pigments quantity is increased. That leads to jaundice. Okay, and that is about this jaundice or icterus. And next see here what we can take, vomiting. Vomiting here, generally here, when we are taking the food, if that food is staying for a long time in the stomach, if the fermentation is happening, if that food has it is indigested, and so at that time the vomiting sensation has taken place. Actually, what is vomiting? The food which is coming out from the stomach, esophagus, next oral cavity, and then mouth. Regurgitation of food, backflow of food from the stomach, next esophagus, and next oral cavity and mouth, that is we can say vomiting. These vomiting centers are present in the what we can say in the medulla oblongata of our brain. Vomiting centers are present in the medulla oblongata of our brain. Okay, and that is vomiting. And diarrhea. Actually, this diarrhea is caused by E. coli infection, heavy E. coli infection, or we can say salmonella or rotavirus. But at that time we will get this diarrhea. In the diarrhea, irregular bowel movement, the liquids are going out through the anus completely. The food what we are taking, so if in that food is not digested, and digested food is not absorbed, and the secretion of intestinal fluid, the intestinal fluids are continuously secreting, and there is no absorption of digested food. There is no absorption of this digested food. Got it? And like this here, the absorption, there is no absorption of digested food, and so here continuously the liquids are going outside. That leads to dehydration. And that person will become weak, and because of he losses the liquids come continuously, their body cells lost their completely fluids. To recover here by using medications and by taking more liquids, and we are using the medications for solidifying the fecal matter. Okay, and also here by taking the ORS solutions, oral rehydration solutions. Okay, and by using that, if severe diarrhea is there, at that time through the intravenous injection we should take the fluids through the intravenous. Like this we can decrease the diarrhea, we can reduce the diarrhea symptoms. That is diarrhea, vomiting. Okay, and next see here constipation. If the undigested food or the fecal matter, if it stays for a long time, in the rectum, that is known as here constipation. Irregular bowel movement. If the bowel movement is not regular, if the fecal matter stays for a long time in the rectum, okay, so that is known as constipation. See, like this, the constipation maybe that leads to how the constipation has happened, because if the food what they are taking, if in that food the fibers are not present, if they are not taking the fiber food, there is a chance to this constipation. So here that's why the people by taking the dietary food, by drinking more water, by doing the regular exercises, and we can reduce this constipation. Like this the constipation is taking place. And next to see here, along with the constipation, there is indigestion. Indigestion is nothing but see here, the food what we are taking, if that food is not digested. Why it is not digested? If we are in anxiety, okay, if the digestive enzymes are not secreted properly, okay, so and at that time, okay, there is a chance to indigestion of the food material. The food is not digested. If the food is not digested, there is no absorption, we won't get the energy. That indigestion food, it goes into outside as a vomiting. That fermentation is happening and it is going into outside as a vomiting. Like this, these all are the disorders. See here what we can say here: jaundice, vomiting, diarrhea, constipation and indigestion. These all are the here what we can say the disorders of digestive system. See, in this we should remember the enzymes. Here in the pancreatic juice which enzymes are present, in the intestinal juice which enzymes are present, in the digestive juice which enzymes are present. See, in the digestive, particularly the gastric juice, pepsinogen, prorenin, these are the two proenzymes. These two are the proenzymes. And in the what we can say in the pancreatic juice, which enzymes are present in this trypsinogen, chymotrypsinogen, carboxypeptidase. These are the enzymes. And pancreatic lipase, pancreatic amylase are present in the pancreatic juice. And in the what we can say next, intestinal juice. In the intestinal juice, first intestinal lipase is present, and along with that, see, dipeptidases, tripeptidases, nucleotidases, nucleosidases, okay, nucleotidases, nucleosidases, aminopeptidases, dipeptidases, these all are present, and along with that one enzyme activator. What is that enzyme activator? Enterokinase is present. What is the use of that enterokinase? Which helps to digest, which helps to convert the trypsinogen into trypsin. Trypsinogen is the inactive form. Trypsinogen is the inactive form. So that trypsinogen is converting into trypsin. Then that is done by the enterokinase. Enterokinase is the enzyme activator. And trypsin, what it is doing, which digests, which activates the remaining proenzymes. What are those remaining proenzymes? Chymotrypsinogen is converting into chymotrypsin. That is done by the trypsin. And then the remaining here is there now that procarboxypeptidase. That procarboxypeptidase is converting into carboxypeptidase with the help of that trypsin enzyme. And pepsinogen is converting into pepsin. So that is present in the stomach. The pepsinogen is converting into pepsin with the help of HCl, hydrochloric acid. And next, the pepsin again, the remained pepsinogen is converting into pepsin by the pepsin enzyme only. That process is, we can say, that is autocatalysis. Itself, it is motivating, it is stimulating. That is autocatalysis. And so that is pepsinogen is converting into pepsin, and prorenin is converting into renin. Generally see, prorenin is secreted in the adults particular, in the infants, in the stomach of the infants. This prorenin is secreted. It is not present in the adult. It is absent in the adult. Prorenin is absent in the adult. It is present only in the infant's stomach. Like this, here this prorenin is converting into renin by the HCl, See, like this, these all points we should remember, and it is the complete brief information about the digestion and absorption. Right? Thank you.